going over getting an understanding of what lipedema is, how to recognize it, and what actually helps with treatment. And I'll be sharing some of the information that I typically go through with my clients when we do a consultation, some things that clinical research has shown us. And it's just going to be an overview, but I'm happy to take questions at the end for some of our more savvy participants or audience today. So this is what we're going to be covering: what lipedema is and why it doesn't respond to dieting or exercise, how to recognize the signs of symptoms in your own body, and what are the treatment and management options that are available. Y'all probably already know me, at least the ladies that are in here. And so I'm an integrative health and physician. I am an obesity medicine certified. I'm also a mindset coach, and I really enjoy helping women to achieve and live their best selves, whether that is physically, mentally, emotionally. And so one of the reasons that I really enjoy and appreciate my knowledge of lipedema and my ability to help with diagnosis is that it's one of those diagnoses that we learn about very briefly, and then a lot of physicians or clinicians don't really understand how to diagnose or may not even be aware of it, actually. And I was looking at some data, and it showed that the number of, essentially it's so often missed because only 29%, so roughly 29.9% of doctors in a survey of 508 physicians reported that they had ever seen or referred a patient for lipedema. So just 30% out of these doctors. And because it's often misdiagnosed as obesity or lymphedema, that's another reason. And because both can happen or all can happen at the same time, it's another reason why it's often missed. So a person who has lipedema will notice that they've lost weight, but certain areas like their hips, their thighs, or their lower legs or arms just simply won't budge. If you've been told that it's your diet or that you need to just lose weight or your hormones or just you're not trying hard enough and nothing is working, even though you know you're doing all of these things. Oftentimes people who have lipedema have heaviness in their arms, tenderness, pain in their legs, their hips, their arms, and those parts of their body feel often disproportionate to the rest of their body. And a lot of times they'll notice this from childhood. So they'll say, I've always kind of noticed my body's different, and they'll just chalk it up to genetics, which interestingly, lipedema does have a genetic component. So it is very likely that it is genetic, but it could still be lipedema. And oftentimes when women come to me with this diagnosis, they recognize, and the reason that they're able to self-diagnose oftentimes is because they recognize that something's not right? Like they know that there's more going on than what their doctors are saying or than what they've been able to easily find access to. And so if any of those sound familiar, you may have the lipedema. So what is lipedema? Lipedema is a chronic progressive disorder of the fat tissue that causes abnormal fat deposition primarily in your legs, your hips, your buttocks, and sometimes your arms. Oftentimes your arms. And essentially what I like to say to my clients and patients is that think of it as not just regular fat, but fat on steroids. And so what happens is that this fat is very inflamed and inflammatory, and it grows, it hypertrophies, it grows to an excess where it affects nerves, it affects blood supply. And because of that, it leads to some of the other symptoms that you can recognize in lipedema, such as, and we'll get into this later, easy bruising or painful areas. And so this almost exclusively affects women. 1 in 10 women are affected. So it's not an uncommon condition, maybe not commonly recognized, but it definitely is a good number of women who are affected. And the onset or trigger is often due to hormonal fluctuations. So can start at puberty, can start at pregnancy, and less often menopause will be onset. However, menopause may be a trigger. Okay, so at any of these stages, these may be the onset and or trigger for symptoms. And when I say trigger, that can mean that, let's say they noticed symptoms earlier in life, prepubescent or around puberty, And then they have a pregnancy, and then their symptoms get worse. And then they have another pregnancy, and their symptoms get even worse. And then they go into menopause, and then their symptoms get worse. So these can be very intense points in a woman's life where they notice that the symptoms they can remember that the symptoms really worsen around this time. It's important to remember that the fat is not just excess calorie related fat. So it's not just fat from like overeating or other things that we think about when we think about obesity. And it's primarily driven by hormones. And it's very structurally distinct, meaning the way that it looks when you look at it under a microscope, when you look at the fat itself, it's very different from fat that we would recognize from excess weight gain. And so because it's different, it doesn't respond to the same things that excess calories or weight gain from other reasons might look like, it might respond to. So dieting and calorie restriction or exercising intensely doesn't necessarily change these areas and how they look. It is a recognized medical condition, so it's similar to obesity in that way. However, it's very different from obesity and lymphedema, and we'll go into that in the next slide. I'm going to pause to see if there are any questions. Okay, good. So, lipedema, lymphedema, obesity. Oftentimes, they can be present all together. A woman can have all three, and oftentimes it is misdiagnosed as lipedema is misdiagnosed as lymphedema. So this table hopefully will break down for you just some of the overview things where the differences lie. And so as we went over, lipedema does not necessarily respond to dieting or calorie restriction and exercise, so these specific areas of inflammatory fat collection. Obesity does, and lymphedema may partially respond. Lipedema, and this is very distinct to lipedema, is painful to touch versus obesity, which is rarely, and lymphedema, which sometimes due to the vascular impact in the different parts of the body or how it affects the blood vessels. Lipedema rarely affects your feet. Obesity and lymphedema can or may. Lipedema is usually symmetrical, and it's triggered hormonally, and that's another distinction. And women with lipedema bruise easily. This is another really important distinction. So whether you're a clinician listening to this or a woman who is, suspicious that she might have lipedema, these are the things you kind of want to put together and start to form that picture that you might have lipedema. Okay. Do you have a question? Okay. All right. So now we've kind of touched on a number of these things already with respect to the disproportionate fat. So areas would be typically legs, hips, arms. And on the arms, you would notice specifically over the elbows, you'd notice a fat pad in that area. A lot of my women who have a lipedema do struggle with that, and fat pads over the knees as well. And oftentimes may have, this will be larger relative to the torso. So they might have a much thinner torso compared to how their arms or legs appear. Pain and tenderness, as I said, is one of the most important symptoms that we notice. The bruising, and we mentioned why that happens because of the way that the fat is growing and kind of pressing down on the surrounding blood vessels. And again, the feet and the hands are spared. And what's interesting is oftentimes a woman who has lipedema will have increased fat on her forearm, so leading up to her wrist, and then from her wrist to her hands, there'll be almost no fat there, or just a regular, whatever the rest of her body would reflect. And so we have a phenomenon called cuffing, where it literally looks like the cuff of the shirt, where it's kind of not bulging necessarily, but there's a bit of a hump, and then you see this like skinny differentiation between the forearm and their hands. Now, how does lipedema affect one's daily life? And so this is an important aspect that I think is not often looked at. because of many different reasons, and we'll get into that here. So lipedema has the two stages or the two parts of lives that I've noticed with the women that I care for are the physical impact and then the emotional and social aspect. Physically, women with lipedema are living in chronic pain, essentially. It's painful to touch any of these areas. And as we shared, it covers a good amount of the body. So they're in chronic pain all over. And it's often described as a deep heaviness. So it feels like their arms or their legs particularly are very heavy, like they're walking through water. Some women will describe to me. And as the condition progresses, because as I said, it's a progressive disease, what can happen is these your arms, your legs start to become so large enough that it's hard to just do day-to-day things like standing for any period of time or walking or even sitting for periods of time can be uncomfortable. And so you can imagine how difficult that can be. And then reduced mobility because of the size too. So ability to kind of bend and tie your shoes or do other things that require to be more flexible. Because of the inflammatory load, a lot of women who have this also experience severe fatigue. So they're perpetually tired, and the smallest effort just kind of wipes them out for the day. And so that's something that I've also heard. Oh, okay. Thanks for sharing that, Leslie. I was just looking at the comments here. And so you were sharing that you have Graves' disease since 94 and also lipedema was at perimenopause. Yeah, I think it's only been a couple of women that have come to me sharing that that their symptoms started around perimenopause. Often women will notice signs earlier, but it's definitely within the realm of what we have seen. So I hope things, we can get into treatment, but having, with the Graves' disease and with now this edema, I can only imagine the fatigue that you might be experiencing when we talk about feeling tired. And so emotionally and socially, there is a lot of body shame and stigma that I've heard from my patients that they've experienced. And I can only imagine how this plays out when within the field of obesity medicine, I hear this a lot. I hear even my colleagues say things like eat less and move more. And there's this misunderstanding or mismatch in understanding all of the hormonal shifts, all of the physiological things that happen in our body that mean that even though we may be eating less and moving more, that we actually are doing the best that we can, but our bodies, because of all these things happening in the background, it just can't do any more to reduce the burden of the fat that we have from lipedema or obesity. And so what ends up happening is that these women are left to feel like they're to blame or that they're just not trying hard enough. And so that seems to be a recurring story. And so I hope that with this presentation in and of itself, that whoever's listening kind of understands the background of what's happening in lipedema and recognize that and we'll get into the treatment options, recognize that when they identify lipedema in themselves or someone else, the steps that they can then take to the right steps, I guess, to then feel better, right? And so as a result of some of these things that I shared, there's that depression and anxiety that can set in. And studies have shown that this happens because of multiple reasons, including and not limited to pain, appearance. A lot of the women that come to me feel very embarrassed to wear shorts or to be out in public or to explain to their even loved ones why they're so tired all the time. And then they feel like they've been failed by the healthcare system. So I can only imagine how that would lead to depression and anxiety. Social withdrawal. So again, because of the pain, because of the appearance and fear of judgment, a lot of women will choose to just stay at home and just reduce their social participation and physical activity. How to recognize lipedema. We've gone through a number of things already that help to identify lipedema, some things that you can look for in yourself or if you're a clinician in your patients. And I want to go over just one more test that seems to be more associated with lipedema and can help to differentiate it from some of the other things that we've talked about. And it's a test called Stemmer sign. And so this is a test where you try to pinch and lift the fold of your skin at the base of your second toe. So if you imagine where your toe meets the rest of your foot, if in a otherwise healthy limb, you can usually easily lift that skin. However, in lipedema, it's difficult because that skin in that particular area has changed structurally and it can be difficult to lift. And of course, while this isn't like the most sensitive test or specific for lipedema, it's one of the tests that we use to help to identify, could this be lymphedema in addition to lipedema, or is this just strictly lipedema? And now let's go over a little bit the different kinds of lipedema, because we've talked about how it can affect different parts of your body. And because it can affect different parts of your body, this leads us to the different types that one may have. So I hope this is clear. I kind of just took this slide from a really great presentation that I saw a few years ago, and you can see the sources here. Let me know if you can't, and I'll try to magnify, or I'll magnify it. But up top, we'll start here. And so actually, I'm just going to go ahead and do that so we can focus on this one at a time. So the different types are dependent on what parts of the body are affected. And so we have women that only have your buttocks are affected. That would be type 1. If your buttocks, your hips, and your thighs are affected, that gives us type 2. Type 3 is when it extends into the lower leg, down your calves. And type 4 is when your arms are affected. And type 5 when it is from your calves, your knees, your ankles, but for the most part, your hips and buttock area are not affected. And so it is possible. Most of the women that I see will have type 4 plus one of these other types, 1, 2, 3, or 5. Okay. And when we want to kind of correlate that to what that, so that's a type, meaning where in your body. And then we have stages, and stages are based off of how severe the progression of symptoms are. And so with stages, as you can see in the picture, stage 1 would be where the skin kind of still looks normal, and you may be able to see or feel some nodules beneath the skin. Stage 2, you start to see larger nodules and more fibrosis in the fat layer and what we call like a mattress-like skin texture or orange peel-like texture to the skin itself. And then the mattressing kind of refers to how the skin kind of overhangs. Stage 3 is when we have really pronounced changes that affect mobility. So you have overhanging skin and overhanging fat. And then stage 4 is where oftentimes, this is the most severe stage, there is lymphedema also associated here. And so you see swelling, and you can see swelling, and in this case, you can see some swelling in the feet as well. Okay. So now that we have an idea of what is lipedema, how does it present, how can I recognize it, what can we do about it, right? If we recognize that either that in ourselves or somebody we're caring for, what are some approaches to management and treatment? So I kind of divided it into conservative management and surgical options. And we'll jump to the surgical options because there's just one surgical option, which is liposuction. And so a skilled plastic surgeon who is trained and has experience in treating lipedema will be able to really help reduce the volume of that abnormal fat that is causing all the symptoms, all the inflammation, all the pain. And so by just removing that volume, that can oftentimes help to reduce the pain. While there's no true cure for lipedema, because there's always the potential that this same mechanism that caused it to happen in the first place hasn't changed, and so it could possibly come back, it does help to reduce the burden of disease so that we have a chance to kind of apply maintenance, and that'll be the conservative management approaches that I'll get to in a minute, to help prevent it getting to maybe the severity of what it was before the surgery, or even possibly prevent recurrence. And of course, best outcomes are when we combine the surgical option with the conservative management. So, what does conservative management look like? I will kind of go out of order and start with nutrition. So, because lipedema is considered an inflammatory condition, there are some studies that show reducing the inflammatory, what you introduce into your diet that may be inflammatory, may help with the symptoms of the pain and the other inflammatory symptoms that are experienced with lipedema. And so an anti-inflammatory diet often means that you're reducing, if not eliminating, dairy from your diet, gluten from your diet as well, and sugar. Those are the top three main inflammatory agents in a diet. And I would say plus or minus, soy has been also linked with some inflammation. So that may be something to consider as well. Then when it comes to kind of lifestyle, I know that we mentioned mobility is an issue earlier. And so sometimes exercise is really difficult for somebody who has lipedema. And so what's recommended, and what a lot of my clients and patients have said, is getting in the water and doing the exercises in the water. So a low impact aquatic exercises have been both helpful with regards to the pain, because I guess being in the water, and often if it's cool water, that can help to reduce inflammation and help with the pain. And then you have that like buoyancy factor of being in the water that can help you to be able to kind of not knock out the effects of gravity to some extent, and allow you to move more easily and do exercises in the water. So those two I have heard have been really helpful. Now, compression garments are really the standard of care for what's highly recommended. And I understand they are not necessarily always comfortable. And that can be one of the biggest complaints that I have from my patients, is that they're not comfortable, especially when you buy them kind of already packaged and just kind of out of the box. However, there are some manufacturers that will do a personalized compression garment for you, and those I've heard are a lot more comfortable. They can be pricey, of course, so that would be the barrier there. And then manual lymphatic drainage, which is part of a complete decongestive therapy. So it's just CDT is just a more intensive therapy that does include manual lymphatic drainage. Often this is administered by a specialist, a lipedema therapist, and who would basically set up a whole program for you. And it can include daily decompression along with compression wrapping and things like that. And lastly on this list, I've got a couple more that I wanted to add. So another device that has been found to be really helpful for my clients are vibration plates. That helps a lot with inflammation, with pain. For some of my patients, they'll do it before they go to bed, and it seems to help them with pain to be able to sleep. Or if they are sitting for long periods of time, getting on a vibration plate can really help them with some of the pain associated with that. And then when it comes to medication, there's not a lot that's been studied, but metformin has been shown to help with some of the inflammatory effects of lipedema and some of the nodules and the fibrosis that are part of those nodules. So getting on metformin can be really helpful there. There are some early studies that the GLP-1 medications, because we found them to be anti-inflammatory for other conditions, that there's some emerging data that it could be really helpful for lipedema treatment as well, and reducing the inflammation there. And anecdotally, I've had a client tell me that a medication called guaifenesin, which is an active ingredient in some cough medications. And so there aren't robust studies that go into the benefit of that medication. However, there, again, anecdotally, and some clinicians have started to find that that medication can help with some of the inflammation related to lipedema. With all of these medications, definitely run it by your physician or clinician to make sure it's something that would be appropriate for you to take. I don't want you to start taking anything without checking with your doctor. And then there are some other medications that can help with weight loss, such as medications in the class of like phentermine that can help reduce body weight, edema, which is a swelling and pain. And then that can also help with quality of life. So again, a question to ask your physician or clinician to see if that may be helpful for you. And that is everything I have to or wanted to cover today. If you are watching this or watching the replay and you think you may have lipedema and you're interested in getting a consultation, I do offer a quick 30-minute kind of let's go through what you're experiencing. Could this be lipedema? And set you up for a full lipedema consult. And I work with an organization that really helps to get women into surgical treatment and to get insurance to cover it. So if you're interested in learning more about that, then you can reach me on any one of these through any one of these platforms, either texting or schedule a consultation or just email me.